ones. Today I will show you the various movement of the hip joint, right? Okay, now this is hip joint, right? Okay, and hip joint is analogically similar to the shoulder joints. We all know this, right? Okay, now in the hip joint, this is the synovial joint, right? Okay, and this is the variety of the synovial joint is what? The ball and socket variety, right? Okay, and this hip joint is formed by the articulations between the head of the femurs and the acetabulums of the pelvic bone, right? Okay, now I will show you the various movement of the shoulder joint, right? Okay, okay. Before going to the movement, right, first I want to tell you the the nerve that are supply in the joint, right? That is one, the femoral nerve, sciatic nerve, and the obturator nerve, right? Okay, these three nerves are supplied in the hip joint, right? Okay, now I will show you the movement of this hip joint, right? Okay, so this is the flexions of the hip joint, right? Okay, so what are those muscles that are involved in the flexion of the hip joints? These are what? The psoas major muscles and iliacus muscle and rectus femoris muscle, right? Okay, and this is a flexion of the hip joint, right? Okay, and this is a normal anatomical position, right? Okay, and this is the what? This is the extensions of the hip joint, right? Okay, in the extensions, what are the muscles that are involved in the extension of the hip joints? The first one, you can remember it by a mnemonic. That is what? The Gautam brings all the metal, right? Okay, now Gautam, G for what? The G for gluteus maximus, right? Okay, and bring for what? The bicep femoris, right? Gautam brings all for what? Adductor magnus, right? All D for what? D for the semitendinosus, right? Okay, and aim for what? Gautam brings all the metal for what? Semimembranosus, right? Okay, now the second, now the third one, that is what? The third movement, that is what? The abductions of the hip joint, right? Okay, in the abductions, what are the muscles that are involved in the abduction of the hip joints? Now you can remember it by mnemonics. Go, play some tournament, right? Okay, go for what? The gluteus medius, and go for gluteus minimus, right? And play for what? The piriformis, some for sartorius muscles, and tournament for tensor fascial artery, right? Okay, and the fourth movement, that is what? Fourth movement, that is the rotation of the hip joint, right? Okay, and this is the medial rotation, right? Okay, and in medial rotations, what are the muscles that are involved in the medial rotations? The first muscle, that is what? The first muscles, we can remember it by all the adductor muscles, and some abductor muscles are involved in the medial rotations of the hip joint, right? Okay, now the some abductor, what are the abductor muscles that are involved in the medial rotation of the hip joints? They are what? The gluteus medius and gluteus minimus, right? Okay, and the final movement, that is what? The last movement, that is what? The lateral rotation of the hip joint, right? Okay, so this is the lateral rotation of the hip joint, right? Okay, so what are the muscles that are involved in the lateral rotation of the hip joints? The muscles that are involved in lateral movement of the hip joints, they are what? They are the first one is what? You can remember it by the mnemonic, that is what? The going for a peaking pair of shoes, right? Okay, so going is for what? The going is for the gluteus maximus, right? And for is what? The quadratus femoris muscles, and for peaking, right? Going for peaking is for what? Peaking is for piriformis, right? Piriformis muscles. Going for peaking pair of shoes. Pair is for two pairs, right? That is the obturator pairs and the what? The gamini pairs. The obturator pair means the obturator internus and obturator externus, and the gamini pair, that is superior gamini, inferior gamini, that are the muscles involved in the lateral rotations of the hip joint, right? Okay, now thanks for watching this video, right? Okay.